I'm Dr. Susanna Hills, and I'm a pediatric otolaryngologist with Columbia University Medical Center and Morgan Stanley Children's Hospital. I get to help people with the very critical elements of life, like breathing, eating, growing very early on, and I get to help children with the way they communicate and interact with the world through hearing and speech and language.
Officials in New York, they're warning of just a devastating week ahead. For doctors who are treating patients every day, they're seeing them, it's been an intense battle, Poppy.
The numbers are just, leave me speechless. I think all of us this morning, the nationwide death toll inches closer and closer to 10,000. With us now is Dr. Susanna Hills, a surgeon at Columbia Presbyterian here in New York. She's been treating COVID patients at her hospitals over the last few weeks. Doctor, thank you for what you're doing, and thank you very, very much for being here. We're hearing the words peak or crest here in New York at some point this week. What should everyone at home take away from what that really means?
I think it is really too early to know for sure. Wouldn't we all love that to be the case? I think that would be the best news possible. I think we'll need a few more days worth of data to know for sure if we are hitting a plateau or a peak. Regardless, I think all of us are of the mindset that we're in this for the long haul, particularly those who are really at the front lines, the emergency room workers, the ICU workers. People like me, we're here starting to back up those other services, taking shifts in the ICU and the emergency department to help out because we're anticipating that this is going to continue for weeks to months ahead. If this is a plateau, if this is a peak, and we're going to start to see things stabilizing, it will absolutely be to the credit of every New Yorker who's been staying at home, making that sacrifice to keep the health system intact so we can treat the people that are coming in.
Is there benefit to kind of experimenting in real time with a malaria treatment in response to coronavirus?
So I think we absolutely have to be listening to the health experts, the medical professionals, when we consider using drugs and medications to treat any disease, especially when we're considering using drugs in experimental ways that have not yet been FDA approved or scientifically proven to have a benefit.
Can you just remind people of what the adverse effects of it can be and the toxicity that can result in taking it if it doesn't work the way that you hope it will?
I actually took hydroxychloroquine when I had malaria about 15 years ago, and it's a very toxic drug. It can damage the organs. It can do more harm than good in certain circumstances, especially when you have a disease that's already affecting the organ systems in the body in advanced, like we see in advanced stages of COVID-19. So yes, all medications have side effects. All medications have benefits. Hydroxychloroquine needs to be treated with a great deal of care and treated on an individual case-by-case basis by a medical team that has the expertise to guide use of those medications.
Dr. Hills, good luck to you. Good luck to the patients you're going to be seeing in these coming days and weeks. We really do wish you the best of luck.
Yeah.
Yes, thank you so much for having me.
I'm going to talk now to two people who are putting their lives on the line every day during this pandemic, one on the East Coast, one in the Midwest. Dr. Rena Oddish is a critical care physician and the medical director of Care Experience for the Henry Ford Health System. Dr. Susanna Hills is an ear, nose, and throat surgeon at Columbia University Medical Center. And Dr. Hills, let's start with you. You're in New York City. There are nearly 18,000 cases there. Just tell us what you're experiencing.
Right now, I think we're experiencing some of the same things that everyone across the country is experiencing. We're all anxious, we're worried. We're worried about our patients, our families, we're worried about each other. And right now, things are really changing on an hour-to-hour basis as we brace for what's coming ahead around the corner in the next few weeks.
A time when we're hearing some very disturbing stories about the horrific conditions inside various hospitals here in the United States. Brian Todd has a closer look at what's happening on the front lines of the fight to save lives. Brian, what are you finding out?
Dr. Susanna Hills, a head and neck surgeon at the same hospital, tells CNN she believes it's inevitable she's going to be exposed to coronavirus.
In my department, the procedures that we do are procedures that tend to aerosolize the virus or emit particles into the air. And that's particularly high risk for exposure.
Some hospital staffers seem on the verge of breaking.
There are lots of ways to wear a mask. Really, all you have to do is find a covering that will cover both your nose and your mouth. And you need something like a rubber band or a tie that can go around your ear and help secure it. The other kinds of masks, the N95 respirators, those should really be reserved for healthcare providers in the healthcare system that are taking care of patients with COVID-19, because we're running really short on those kinds of supplies. So all we really want the general public to be doing is using a covering to cover both their nose and their mouth when they go outside. There is a proper way to wear a mask. In the studies we've done where mask use tends to fail, it's usually because people aren't wearing the masks correctly. So to be effective, the mask has to cover both the nose and the mouth, like this.